Today we will learn the pectoral region. So these are the basic incisions that we have to take in the pectoral region. The basic landmarks, first of all, this is the suprasternal notch, which is also called a jugular notch. From the suprasternal notch we have to take a vertical incision up to the infrasternal angle. Then we have to extend this incision laterally up to the mid-axillary line. Then from the lower end of this incision, we have to take one more incision obliquely and upwards, encircling around the nipple, which will preserve the nipple as a landmark to identify the pectoralis major muscle. And we will extend this incision over the arm towards the axilla, so that we can uncover the upper part of the deltoid muscle as well as the upper part of the front of arm. Then the upper end of this incision in the jugular notch, we will extend it up to the acromion. We know that clavicle, it is a subcutaneous throughout. Next, the skin, we can see the platysma muscle over here. Platysma, it is a subcutaneous muscle. Then we can see the underlying fascia beneath the skin. We can see the fascia. The contents of the fascia, they can be seen, that is cutaneous nerves, vessels, lymphatics. All of these are seen. When we hide the fascia, we can see the pectoralis major muscle, which is highlighted now. After the pectoralis major muscle, you can see the deltoid. So over here you get the deltoid. These are the anterior fibers of the deltoid, and these are the acromial fibers of the deltoid. In between these two, here you can see this is the cephalic vein. This particular gap which is present in between the pectoralis major muscle over here and the deltoid muscle, it is called as a deltopectoral groove. So this is the landmark to find cephalic vein. So we will hide now the lymphatics and the veins. This is the cephalic vein, which is highlighted in purple color. Pectoralis major, we have hide the pectoralis major muscle so that we can see the underlying structures. The structure underlying it is the pectoralis minor muscle. So pectoralis major, it is a large muscle in the pectoral region, whereas pectoralis minor, it is a smaller muscle in the pectoral region. The pectoralis minor is on a deeper plane than the pectoralis major muscle. The thing which is not visible here, it is the clavipectoral fascia. So we will try to draw the clavipectoral fascia. As we know, the clavipectoral fascia, as the name suggests, it extends and in between the clavicle, and it covers the pectoralis minor muscle, and while going towards the pectoralis minor muscle, it also encloses subclavius muscle. So clavipectoral fascia, it is the fascia present deep to the pectoralis major muscle, and it covers two muscles, that is subclavius and pectoralis minor muscle. So clavipectoral fascia, it is another topic that we will discuss some other day. Today we will just mention the structures piercing clavipectoral fascia. So for the sake of simplifying the things, I have hide the blood vessels and veins and the lymphatics. Only nerves are visible now. The muscle highlighted, it is a pectoralis, minor muscle. So this is lateral pectoral nerve which supplies pectoralis major, and this one is a medial pectoral nerve which is supplying pectoralis minor muscle. So medial pectoral and lateral pectoral, these are branches from the cords of brachial plexus. Now I am drawing the clavipectoral fascia. So this clavipectoral fascia, as we have already discussed, it encloses two muscles, that is subclavius and pectoralis minor. So what are the structures that are piercing clavipectoral fascia? Structures piercing clavipectoral fascia are cephalic vein, then acromiothoracic artery, cephalic vein, acromiothoracic artery, and lateral pectoral nerve and lymphatics. These lymphatics will pierce and drain the lymph towards the apical group of lymph nodes, which is also called as infraclavicular group of lymph nodes. So all these things we will see in the next few frames. So beyond the pectoralis minor muscle, it continues as the suspensory ligament of the axilla, and it helps in keeping the skin of the axilla pulled upwards. Now again I have unhide the blood vessels. So first structure that is highlighted with the purple color, it is acromiothoracic or thoracoacromial artery. So branch from axillary artery. Second structure, it is the cephalic vein which is piercing the clavipectoral fascia, highlighted with the purple color. We have already seen the lateral pectoral nerve. One more time we will see. So this is the lateral pectoral nerve, and now I will unhide the lymphatics to see the lymphatics with the apical group of lymph nodes. You can see all the group of lymph node, apical group of lymph node, it is highlighted with the purple color. So important short note, that is clavipectoral fascia encloses two muscles, and the structures piercing clavipectoral fascia we have discussed. So once we remove the pectoralis minor muscle, underneath we can see the intercostal muscles and the serratus anterior. Now the serratus anterior muscle, it is highlighted. The serratus anterior muscle, it is not a muscle of pectoral region, but it makes its appearance in the pectoral region. So we study it along with the pectoral region. You can see the upper part of the external oblique muscle also. So this is the entire external oblique muscle, and you can see the in the pectoral region, you can see the pectoralis major muscle covering some part of the external oblique muscle. Now this is the frame to show you the origin, insertion, nerve supply and action of pectoralis major muscle. The purple color is showing the origin of clavicular fibers which are arising from the anterior surface of the medial two-third of the clavicle. The sternal fibers, these are arising from manubrium sternum as well as body of the sternum. So now it is highlighted with the purple color. The insertion of the pectoralis major muscle, it is on the lateral lip of the bicipital groove, lateral lip of the bicipital groove, or the lateral lip of intertubercular sulcus. Now what is the action of the pectoralis major muscle? It is mainly adduction, then flexion, medial rotation. So all these actions are shown in next few frames. Here we can see the adduction. Now this is the medial rotation, which you can see. This is the flexion of the shoulder joint. And the clavicular fibers, they help in depressing the shoulder joint. So depression of the shoulder joint, it is done by the clavicular fibers. Next we have pectoralis minor muscle. Pectoralis minor muscle, its origin, insertion, nerve supply and action we will discuss. The pectoralis minor muscle, it arises from third, fourth, fifth rib, third, fourth and fifth rib and the costal cartilages, and it will insert on the coracoid process, near the tip of the coracoid process. This muscle, it mainly helps in the protraction of the scapula. When it contracts, it pulls the coracoid process of the scapula forwards. This helps in protraction of the scapula, and also it helps in depressing the scapula. These are the attachments of pectoralis minor muscle. Now the serratus anterior muscle. Serratus anterior muscle, it arises by 8 digitations from the upper 8 ribs. So it is described as, it is arising from the middle of the shaft of the ribs, and the insertion, as you can see, it is inserted on the costal surface of medial border of scapula, costal surface of medial border of scapula, now highlighted with the purple color. This muscle, it is also called as boxer's muscle. It helps in pushing and punching. It helps in pushing and punching. So its action is protraction of the scapula. The scapula glides over the thoracic cage with the help of the serratus anterior muscle. So these are the different views of the serratus anterior muscle. Now the small muscle, that is subclavius. The subclavius muscle, it arises from the upper surface of the first rib and inserts on the subclavian groove, which is present on the inferior surface, of the clavicle. Nerve supply of this muscle is nerve to subclavius, very easy to remember. this is subclavius muscle. Now what are the other important things that we should learn or we are able to see in the pectoral region? These are the branches of axillary artery. So to understand axillary artery and its course, we have to remove the clavicle from the frame so that we can see the continuation of axillary artery. The axillary artery, it is a continuation of subclavian artery at the outer border of first rib. So this is the outer border of the first rib, and we can see the subclavian artery. It is continuous as a axillary artery. So now we will highlight the axillary artery. This is the axillary artery and its branches. The axillary artery, it is divided into three parts by the pectoralis minor muscle. So pectoralis minor muscle, superior to the pectoralis minor muscle or above the pectoralis minor muscle, it is the first part. When we remove the pectoralis minor muscle from the field or from the screen, we can see the second part of the axillary artery, which lying below the pectoralis minor muscle, and inferior to the pectoralis minor muscle there is third part of the axillary artery. So what is the trick to remember the branches of axillary artery? It is 1 1, 2 2 and 3 3. That means one branch from the first part, two branches from the second part, and three branches from the third part. So what is the trick? It is 1 1, 2 2, 3 3. That is how you remember the branches of axillary artery. So what are the branches of axillary artery? These are superior thoracic, acromiothoracic and lateral thoracic. Now the purple color is highlighting the lateral thoracic branch. Now this is the course of axillary artery, which is highlighted. So the axillary artery, it begins at the outer border of first rib and up to the lower border of the teres major muscle. Lower border of teres major muscle. So axillary artery, it will be taught to you in detail in the axilla session. So these are the branches of axillary artery. These are highlighted. So this is axillary artery. So here, if you follow the pointer, this is the superior thoracic. Then this one is the acromiothoracic. Third one, it is the lateral thoracic. Then the green color is showing anterior circumflex humeral artery. Now if we slightly turn it, we can see the posterior circumflex humeral artery. So these circumflex humeral artery, they wind around the surgical neck of the humerus. They wind around surgical neck of the humerus. So anterior circumflex humeral and posterior circumflex humeral arteries. These are branches of axillary artery. So now we'll see the last branch, that is the subscapular artery. So this one, it is a subscapular branch, and the subscapular artery, it gives one more branch which winds around the lateral border of scapula. It is circumflex scapular artery. So I hope It was a fruitful session to learn the pectoral region. Structures that we learn, these are muscles, that is pectoralis major muscle, pectoralis minor muscle, serratus anterior, subclavius. Then we had a brief discussion of clavipectoral fascia and branches of axillary artery. Thank you very much.